So I got to put this on video because I asked the question and answer, and the question was, how do I deal with the daily depression? And the nurse is here, and she's gonna give me some tips, but I'm not gonna put her on camera. But she's gonna give me she's giving me some tips because, okay, so I guess let me try to sit this here some kind of way. I know I'm looking crazy, but it's okay. It's okay. I'm working on it.
It's okay. You're allowed to have moments.
Okay. I'm working on it.
Okay, see your finger, Chester. So, I was going to say, every day is going to be different. See your finger.
What can do?
Measure your oxygen level, Chester. Measure your oxygen.
Oh,
Your oxygen level. You're okay, honey.
yeah, but I see you take coffee.
No.
No.
So you're saying, like, okay, so
So-
here's my thing.
Yeah.
My thing
What
is
bothered
with
you? Yeah.
what triggered me tonight.
Yeah, what's the
What
trigger?
triggered me tonight was him not being able to breathe, and him soiling himself at the same time.
Yep.
That messed me up. You know, to see him, he can't breathe and
struggle.
he's pooping himself at the same time.
Yeah.
That just took me out. It just took me out the game. It just took me out.
Yeah.
So that's where I'm like, okay, let me ask this question because I do like really walk in the word as much as I can.
Mm-hmm.
You know, I mean, I don't even leave my house.
Oh, you don't even. Oh, you need a. It sounds like sometimes you need a break to yourself. Okay.
Well, I don't. I have the. They come and relieve me. So
Okay.
the respite.
Okay. I was gonna
So
ask
I get 4 hours a day.
Okay.
And then I use. What would you like, Papa?
Oh, I didn't know.
So I'm trying to. During that time, I usually sleep because I'm with him all night.
Yeah, give yourself a break.
And
Absolutely.
I haven't. I don't know what that looked like.
No.
So.
Okay.
So, because I don't really, outside of what I get in respite,
Yep.
I don't get a break. So, because of that, no, I don't do anything outside my house. You know, because every day there's something important happening with him.
Yep.
It's not like, and then family be like, well, why haven't you called? Yo, homie, I ain't got time to sit up and talk to you.
No, I'm watching. It's a 24-hour job to watch.
It's a 24-hour job.
That's right.
And if he's like throwing, lately he's been doing weird stuff like
I was gonna ask you about that.
throwing poo on the floor, bro. Like,
Yeah.
what is going on, man?
Yeah, especially with Alzheimer's, dementia, and people that are having a decline, they will do certain things like that, and it's just part of the disease process and the decline. So we find ourselves digging and picking and throwing.
Yeah.
Yes, and it's very common with our Alzheimer's dementia patients to do that.
Okay.
Um,
So when families asking why can't I return calls, either I'm getting poop or pee up out my floor at 4-5 o'clock in the morning, or constantly changing him,
Yeah.
or something. So I don't have time to call you.
No.
And they're talking about going out. I don't have time for a personal life.
Yeah, right now, and that is, and sometimes,
What in the world is?
yeah, and it sounds like family's not listening or hearing. What
No
you're
one's
saying.
listening to me.
I hear you right now.
No one. And I'm saying, I feel like I'm gonna break because this is my only parent,
Yeah.
and I'm watching him
deteriorate. Yeah.
just every day.
Oh, I'm sorry.
And I'm like, what do I do?
You are doing a wonderful job. You know why? He is safe and he's in your home and you're caring for him. He has food and drink and he has toilet. Yes, things every day is going to be different with him, but it sounds like you need a break too, even with the little bit of respite that you get for them to come in. I don't know if you have family that are going to be like, okay, I'm going to come over and watch him for 4 hours or 5 hours so you can get out. I need to go to the grocery store. I need to go, and you know what I mean? You just need to get some fresh air and get out of this, because you will start to go crazy staying in the house 24 hours a day.
Okay, maybe that's what I'm going to.
Yes.
Because
Yes,
I don't
I've been
like only time
caretaker.
I leave my
Yes.
house is to run to the grocery store, or you know what I mean.
Yeah, you run
I don't
quick
get
and
it
then back.
right because I'm so concerned,
Yeah, you love him and you're
and
concerned.
it's like I'm trying to get out of like the high anxieties. But since they told me he only got 6 months to live, I'm always in
Very
high
focused.
anxiety. Yes,
And that's
and
the
it's
thing.
like, okay, we only got 4 months left, and I'm trying not to have that in my head.
Oh, try not to have that in your head. So,
Yeah.
because we always say yes, a lot of our patients, it's just a number to qualify for hospice. We always say yes. Could it be 6 months or less? Yes. Could it be longer? Yes. Have we had patients on
So I wish they didn't tell you that because
I
I've been
know.
stressed
It's
since
in your head.
then.
And
Right. So the high
This-
anxieties.
Yes, and I've been through this because my grandmother and my mom, we all lived together. And the minute they told my mom about my grandmother's 6 months, she did the same thing. She looked at the calendar, she looked at her phone. I got 3 months. I got 200. I got 60
You don't
days.
need to.
No.
You don't need
You
to.
don't need to focus on time and days.
And you do not mean to.
You don't need to, but it's still planted in your head.
Mhm.
And you still focus on it. And that's what I tell my mom. I said, we cannot focus on it.
Yeah.
We need to just enjoy it and just focus on what we're doing.
Yeah.
And I always tell my mom, or to my patients, let's look at what we do have. They're at home, they're still with us, and we're caring for them the best we can.
Most times I'm okay.
That's okay.
But when the trigger, oh my God.
And we need.
Oh my God.
Here's the thing. Me and the rest of the team, we need, every time we see you, we need to prepare you and educate you and empower you and say, hey, if you see this is what you're going to do. If you might see this, and we're going to tell you, you may see this, this, or this. But we're going to tell you what to do. Or if you panic and you don't remember what we told you, call us.
Right.
And then we're going to instruct
That's why I
you
keep
over
my
the phone.
book.
Yep. And keep that book. Option 2, get us on the phone. And we're going to tell you, give this medicine, do this. We're coming over, X, Y, and Z. Now, I know you have a little bit of respite care coming in to help you. But have we told you about the 5 days respite?
Yeah, they
One
did.
time. So like a one-time free.
And I was trying to like save it in my pocket for a
Yes, I know. People always keep it in their back pocket.
Try to
They're
keep
like,
it in my pocket for
yeah,
a real emergency.
emergency,
Like I
right.
just had my biopsy. I didn't even use it for that. I used my regular respite.
Yeah.
And it's like, and that's another thing, like my own health. So it's like my anxiety. I know my cortisol levels are probably through the roof.
Yeah, you're in
That's
fight or
usually
flight,
why I'm
and
like
that's
planning my trip to Thailand. Looking forward to going to the city of smiles or the country of smiles to like reset my nervous system because
Yes.
man, this
This
is
is stressful. I've been through
and
it
no,
with my family.
and that's it. No 2 days are alike.
Nope.
So people like asking me about my sleep, and I go, "What sleep?" Like he's on a 3-hour.
Yeah, I'm
you
up with
know.
him every. Yeah.
So like in this camera, stuff that I've set up
You have to watch
in
him.
motion, so it always
You know.
wakes me
Yeah,
up.
you're like,
Yeah.
you watch him.
So and then when the hospice come in daytime,
Yeah.
that's when I'll go to. Well, when you guys come in or when respite, that's when I get rest.
Gotcha.
So that's the reason why I'm usually sleeping in the daytime.
I see. And then you're up during the night. I just
Yeah.
wanted you down here so I can kind of talk to you about symptoms and what happened. So I know what I need to order or ask to get ordered from our doctor.
Oh, is it like this?
Yeah, because I know because Michelle told me you guys had comfort meds, but from another hospice, not from us.
So for
yeah.
all my viewers, because I've been trying to blog this to help with my mental health, because I'm really big on mental health.
Absolutely.
Okay, so what they gave him before is lorazepam and 0.5 ml. So, and it's just a squirt in his mouth. Basically, this is morphine, right?
So the lorazepam is an anti-anxiety medicine. It's what we call a benzodiazepine.
Mm-hmm.
So it helps relax him, but it can also help with nausea and vomiting. It kind of does a few things. Now, with our elderly patients, I don't know, you have to know him. If you've given it to him and he gets real relaxed afterwards or sleepy, that's good.
Mm-hmm.
Some of our elderly patients take it and it makes their confusion worse.
See, and that's what he's really sensitive. So
And
I
that's okay.
think that it is kind of doing that. I do.
And it might make him more confused, but we could also give other medications that's a lot stronger. It's called haloperidol or Haldol.
Okay, well, if this is why would we give him something stronger?
So, usually if they're Sometimes, I know. So we have levels.
Okay.
Lorazepam help relax them. Sometimes it doesn't help with everything.
But isn't that a psych med?
Yes, it is.
Okay, why are we giving them psych meds?
So
Why?
we give our patients
Why?
because as they go through transition or they start to kind of deteriorate, they can have agitation and restlessness. And sometimes they can get pretty angry and hit us and throw things and have hallucinations and really just be angry. And sometimes we need to give them some medicine just to help get them relaxed, and it helps them get some rest and go to sleep, especially at night. And it's not like we give it to them all the time. You can give it to them every 2 hours if you needed to, but a lot of our families only use it when they absolutely need it. Because we do.
Okay, where's this other one?
They have had. We haven't.
Yeah, I know I have this one.
Because and the thing that what I need to know, because that's from a different.
Right. Right,
So
they like dropped him. The other hospice service, I'm gonna put this on record. The other hospice service dropped him because he had a spell in the middle of the night, and I called them and they said that they're not available.
Right. We're available 24 hours.
I know, that's the reason why I chose y'all, and you guys are nonprofit.
Yes.
So, but
I need to get you our comfort kit ordered.
okay, and
And
this is called a comfort kit.
That's part. Let me see what they gave you.
Yeah.
So they just gave you one medication that we have in our comfort kits. Lorazepam. We usually give our comfort kits morphine, lorazepam, and haloperidol. That is our combo comfort kit pack. That some of our families, they don't need. They keep it in the fridge until they're ready. And then when we start to have symptoms and we need to treat those symptoms,
Okay,
then we
he's
come out and
pooping
help you.
himself.
That is gonna be more of a.
Well, they said
disappearing thing.
stage 6E, and that's where he's at.
Yeah, so he's gonna, yes. At this point, he needs total care. Like, he's gonna need assistance up to the bathroom. He's gonna have accidents.
Well, that's what we do.
Yep.
I don't let him get. That's the reason why I have the bars on the
Exactly.
bed and everything. I don't let him get up by himself.
Yep.
That's the reason why I don't sleep.
It's like,
Yeah, I
you're
don't sleep.
constantly getting
I don't sleep. And then it's like at night dealing with him, and then at daytime dealing with his doctors or you guys, or because some stuff I have to be there as his power of attorney.
Yes.
So it's like some days I don't sleep at all. Yep.
And that can drive anxiety too. 'Cause
Right.
yes, you're sleep deprived.
Because right, and I know it. It's like I don't mean to be mean.
No,
I really don't.
We
I just don't
understand.
sleep.
No, we understand it. We live it in hospice. We understand. So we don't take anything personal. We just want to help you and him, and we need to try to find. a
Okay,
happy
I just
middle.
want to, because I know anytime you catch a cold, you end up with pneumonia.
Is
So
that normally? Like, I'm gonna give this back to you.
Okay.
I want to take a good listen to his lungs. Now, have you noticed him coughing up anything, like in the tissue or just? on
yeah,
himself?
he's been caught a cold.
What color would you? Have you got a chance to look at what color that sputum is?
Yeah, it's not like it's really light yellowish.
Light yellow?
Mm-hmm. Whitish, yellowish.
And then when
It's disgusting.
his oxygen was dropping earlier, I know you're tired. Did you give him? I'm one of the nurses. Did you give him a breathing treatment?
He wouldn't let me finish. So
What
he
did
only
you
took-
do to him?
So I tried to give it to him, and he just kept like taking off, saying, "I can't breathe, I can't breathe." So he got maybe like 25% of it.
It's okay. And when we're having anxiety like that, I always say, give him your anti-anxiety medicine, give him some lorazepam, and just try to hold it. Even if it's not completely, if he has the mask, even if it's not on his face, even blow by as much as you can.
Oh, there we are, staring at food.
Like right there, hold it next to him. I know, I hear you. I'm gonna listen to your lungs.
What?
I'm gonna listen to your lungs. I'm with my stethoscope. Are you able to take a deep breath in and out?
Yeah.
All right, can you breathe in and out?
Huh?
That's okay, I'm listening.
Okay.
All right. Thank you.
I know he has a CT, a chest CT scan coming up on the 23rd.
Stay there.
Is it really bad wheezing?
Not too bad, actually. I thought he was gonna be a lot worse.
Okay, so then when he stand up, it's just bad. It's
It's just
horrible.
that, yeah, and sometimes So mesothelioma and COPD, correct?
Mm-hmm.
I'm gonna get my papers out so I have all of this stuff next to me. Let's see how much I have through. Here's some oxygen. Okay. Now, I just need to ask you a few more questions just about him so I kind of get an idea. So now he's more incontinent, like so bowel and bladder. He needs more.
Oh, yeah.
More incontinent.
Yeah.
How's his appetite? Is he still able to swallow food and he's not coughing, choking?
Nope. He's good. He's good
Okay,
there.
he still has a good appetite.
Oh yeah, he definitely like his sweets.
But we're having more like bouts of confusion and restlessness.
Yeah. Yeah.
More frequently. And then I have here he's not allergic to any medications, right?
No.
How many, I didn't print that out. How many times a week do we have the CNA come out to you guys from us? Like the aides to help bathe from us. Have you had any aid visits?
So far she's I only seen her once a week.
Okay. Maybe
But-
we might need to get a few more.
Well, that's what I thought they were gonna come three times a week.
Yep, usually we'll go from
Monday,
to
Wednesday,
Thursday.
Friday.
Okay, I'll make sure.
But I think she wasn't able. I think the one who they assigned is only available twice a week or something. I don't know. I'm not sure
That's okay. I'll have to ask.
I'm gonna double
home
check.
care.
because I have so much going on.
No, it's okay. Don't even worry about it. Because these are things I'm trying to put it all together in one visit. I want to get all his medications he needs. I want to make sure his
And then
visits
this is
are
what
set up.
overflow is in this cabinet right here.
You guys have lots of supplies. I just need to make sure.
Gloves and masks need more.
Okay.
PPE because like HHA and respite, they come in as well. So I don't know if I'm trying to figure this out.
It's okay. Just so I can, we give you supplies. I know you guys signed on with us on the 27th, so we're still getting things in order here for you guys. Let me make sure. I'm just looking at a few things. Sorry. Make sure not just Jasmine, Danny. Okay, so Jacqueline comes out to see you guys.
Yeah. But I don't know if it shows what days of her availability.
Let me see what they have on the schedule for the journey. And then, because when I make my note from this visit, it goes to all the staff members on his care team.
Okay.
So,
Okay. Perfect.
social work, spiritual team, home care nurses, everyone on the team. And then if I need any more suggestions, because they have Jackie set up to see you guys. Let's see, this week she saw you on the 10th. The CNA came out to you on Wednesday. Let's look at the next week. Yeah, so it looks like Jackie's are set up for Wednesday.
Yeah, it's just once a week. Yeah. Okay,
Yeah.
so I was right.
So nurses, and that's very common. The nurse, unless we start to see more of a decline and need more frequent interventions, then the nurse visits will start to pick up.
Like what I'm going through now,
So
would that be considered like more of a decline?
we're talking now.
Dude, I'm getting poop off my floor at 4 in the morning.
This is gonna be.
I had to buy. Did you see?
Does
I
he
had.
have diapers? And he has lots of. Will he pull off the diapers? Does he have?
Oh, he have not done that yet.
Okay.
Please tell me he's not going to pull his diaper off.
No, he could.
Okay.
I just didn't. I want to make sure he had one on because some of our patients, yes. Do they pull off them? Yes. Do they pull everything off?
Oh, actually, you know what? If it's too soiled,
He'll start to and
he'll
that's
take it
normal,
off.
yes, and
If that's what you.
normal.
Okay.
And that's a
Okay.
normal reaction. Most
Oh,
of our
okay.
patients, yeah, especially our dementia confused patients that can't tell us, hey, I'm dirty, I need help. They'll just start pulling it off or
Yeah, he will do that. He'll
so
do
that's
that.
kind of like their signal, hey, he's digging or trying to pull at it. He's probably dirty or needs to go to the bathroom. He just can't tell you these things.
Yeah.
So, now with his formed or is he having diarrhea?
Oh,
His
it was liquid.
Liquid diarrhea.
Yeah. I'm
Just so I
trying.
know what
I'm
I'm
gonna laugh
That's
because
right, you
it
laugh.
keeps
It's-
me from going insane of picking up liquid
That's right.
poop
Poop off your face.
off your
That's
floor,
right.
out of your carpet
That's right.
in the middle of the night,
You're like,
and you're like, you know what, Jesus? Wait a
you're like, oh,
minute.
yes.
Wait a minute, man. Yeah.
Okay.
Yeah.
And that's why us
Yeah.
healthcare workers and some of us nurses,
Yeah.
we we have a twisted sense of humor sometimes.
Right. Because
how
you
else
gotta
we-
laugh,
we-
because
we
I'm about
do
to
it
go
all the
crazy,
time.
man.
Yes,
Yep.
and how else are we gonna do
And
it?
then-
We laugh about it.
And then it's like, right when I clean you,
You go again.
or you pee all, like, how did that happen?
And that's
Yep.
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 Oh,
And it's
I
always
hear
when
you.
you're like, okay, you know I'm really going on 2 hours of sleep right now.
Yeah,
Please.
You're tired. You're like, please,
Yes.
can you just stop? Yeah, could you just lay down and go to sleep before I lose my mind? Yes. Yes, I hear you. So.
But this has helped
I was gonna
him
say
sleep longer hours because his 3-hour sleeping cycle, I notice, has gone a little bit longer, like 4,
Yep.
5 hours.
And I was going to tell you, sometimes our patients, if you're seeing some good stretches of sleep, family members will put their loved ones on a schedule, even though it says as needed.
Mhm.
Sometimes they know. Okay, we're going to get cleaned up.
Oh, okay. And you help him?
Like,
Okay.
That's okay. You want to sit up? I know.
I was trying not to get the nurse,
It's okay.
but see if I need help get Papa.
You want me to help him get back into bed?
Yeah.
Okay.
Okay, Grandpa.
Because
We
I'm
gotta,
gonna get some.
okay, we gotta get you back in the bed, Papa.
Want to do what?
Get you back in bed, okay?
We go back to bed.
Yeah.
Okay, the nurse is checking you out. She said your breathing sounds okay.
It doesn't sound too bad. You
It
got
don't
most
sound
of
too
that.
bad.
Alright.
Yeah, so I've been using like that new, there's this.
Okay, you finna go back to bed.
Huh?
You said you finna go back to bed.
Oh, you got crumbs all in your bed. I mean, it's everywhere.
Put it in my mouth.
No, not me. Yeah, and this stuff's giving him dry
Yeah,
mouth. And
shake,
he's,
cook it.
What's drawing?
I'll bring you some cookies down later, Papa.
Okay.
Okay.
He likes his cookies.
Yes, he
That
likes
way.
his cakes
Try
and
not to get all
cookies.
over the floor.
Yeah, I'm seeing it all in his bed now.
Mm.
I know. Here, let's just get it out.
Okay.
I know.
Okay.
Alright then.
She's gonna help get you back in bed. Yeah,
Alright.
so it's just trying to.
Alright.
I know. Let's put this out of the way.
Okay, come on.
Is he able to take a few steps?
He act like he can't lately.
Okay, and that's
That's
what
what I'm concerned.
Yeah.
It's but I know it's the medicine. Okay, Grandpa.
You're gonna stand up.
Uh-oh. We need you to stand.
Oh.
And then can you take a step for me?
Oh.
Here, can you hold this, DJ? And please don't get the nurse in the camera. Thank you. Okay.
Okay, keep going.
All right, come on. I need you to walk.
Good.
Come on.
Keep going. I gotcha. Okay.
Oh.
Okay, take a side
Grandpa,
step.
come on. Come on. Take another step.
If not, I'll just pull them.
Come on. Take another step. Okay.
Good job, honey.
Thank you.
Okay, go ahead and sit.
All right.
Oh.
Sit. There we go. Good job. Now we're gonna get your legs in.
All right.
You gotta lay down. We're gonna put your legs in the bed.
Oh.
Okay. So I just usually yep. We just swing them on in.
I have to get him to actually
Okay.
that way.
Yeah.
He does not. He fights me. And then no sooner than I lay back, get him laid down.
He'll sit right back up again.
I'll be like, dang it! I'm out of breath.
Mm.
Put that back in.
All right.
All right. Where is?
Oh.
Does he have? Where's the little control?
Right there on the side.
Where's your little controller? So I can pull it. I'm gonna put your head down because I'm gonna pull you up. I'm gonna put the head down
So she can
so I
snatch
can
you
try
up
to
there.
get you up a little bit.
Mm.
I know. I'm trying my best. I don't know how strong I am today.
Yeah, no
You
problem.
might help me.
All right, slide up.
Slide up a little bit. Are you able to scoot back?
Okay,
Slide
what is
up.
all
Yeah.
this on here? Oh, I don't know.
Lay on
something.
back. Yeah, there's cookies and crumbs and water on the floor.
Okay. See, that's the reason why I got that D-Vault. It's like what are those called? Those
Still
cleaners.
no coffee, right?
No coffee, honey.
No coffee,
We're getting
Papa.
ready for bed. It's nighttime. Are you able to scoot back in bed? Can you scoot up? Because I'm not strong.
I know, not from one side. If you're
Yeah, I need
ahead
to,
of it, yeah.
Are we able to? This
Okay.
so it'll fall. If I'm able to move the bed out and back a little bit and get behind him and pull him up.
Okay,
or
let's see. I'm gonna sit this here. No,
one on each side.
I'll try. Here.
And then we're gonna move them up. And then we're just. Oh, I was gonna use the sheet, honey.
What do you want me to do?
Like, no, here. And you just. I just don't want you to hurt yourself.
What do you want me to do?
I know. I'm just trying to slide you up.
We're gonna slide. We're gonna try to use the. See?
Slide up.
Yeah. But
Slide
then
up.
he does that.
Oh,
He tightens himself.
Yeah.
oh.
I was gonna use the sheet. Okay, that might be as good as we're gonna get it because I have a feeling he's gonna try to want to get out.
Yeah, he probably will.
Let's get the railing back up.
Okay.
And then we'll put his head of the bed up. Okay. And then I'm gonna give, if you don't mind, we'll give him some lorazepam.
Okay.
So we can try to get him comfortable and it's to keep him in bed
Okay.
for a little bit.
Okay.
Right. Yeah. So for shortness of breath, we did the right thing. Head of the bed elevated, oxygen in place, do your nebulizer treatment.
Right.
We did everything properly. We did everything's good. But
He
sometimes
just gives me the blues,
I
man.
know. And there we go. Zip up further.
And I'm like, I'm glad I got my CPR certification because this
So-
man.
Now,
Okay.
put the pillow behind your head.
Oh, let me close these closets.
Now, my question to you. In the event of an emergency,
I'm supposed to.
to call us. And
Right.
Not 911.
Right, because that kicks him out of hospice. Well, I just called the VA.
Essentially, we'll have to come and evaluate him because if they'll take the paramedics will probably take him
Oh no,
to the
no,
emergency room.
right, and then they won't take him to the VA hospital there because they're not quote unquote contracted with the VA hospital.
Okay.
So
So just know, try to call us first, and we'll try to help walk you through it.
okay,
But if you've what us hospice nurses like when we come out, I'll definitely call the doctor. I'll ask him about. Oh, that was the one question I was going to ask you. In the past, do you know what antibiotic he has taken?
right here,
Has
Yeah.
he- So we can try to, if it's helped, maybe start him on the same thing.
right there. I keep everything.
Just like.
Let me just sit this down. Do you see the antibiotic there?
Is it in this little bottle? Just grab it for me. Which one? Oh, I didn't see it back there. I was like, which one is it?
Erythromycin.
Yeah, grab that. Let's see. Let me see what he's been taking.
And then there's this one that they gave for cough. That's not that one. I don't know. I thought it just made him cough more.
And usually it might be because some of them
Right,
are what we
it's
call an
expectorant,
expectorant.
yeah.
Yes, and that's what we. You think
Yeah,
it's gonna
this
help, but
one,
it breaks
yeah.
it up and oh yeah,
That
breaks it
just
up.
made him
Yeah, that's gonna
worse.
make, yeah, it's gonna break things up and make him cough it up more.
I mean, he was miserable.
Okay. So what I need to do for you right now, I need to message the doctor real quick
Okay.
so I can get erythromycin started, get you some more comfort meds ordered.
Okay.
Pain doesn't seem to be an issue with him.
Oh yeah, he's well
He's got
because
a pain patch I saw.
so they're supposed to be ordering. You guys are supposed to order those.
Okay.
And here's it right here. Let's see.
I was like, how often are we doing it every 72 hours?
Oh my word, where'd that box go? Where'd that box go?
That's okay.
I forgot who was out here. She wrote it down.
I have a list. Yeah, it's probably one of the nurses.
Right.
That's fine. I have it on this page.
I'm so sorry. I usually be trying to knock out.
This one.
Yes. I knew it started with a B. I just couldn't. I was like,
It's
I
okay.
just.
All right.
Is it?
Okay, so
Okay.
it's weekly. I just wanted to see
Right.
how often he's changing them.
Right, you change it once a week, and there was enough in there for a month. So, yeah, because he had
Yes,
4
when he-
patches. He has on the last one, so that one should.
When does it due to be changed? So I know.
You know what? I've been on graveyard, man. I haven't been on days to know when. Because that's why I tell them put it up here so I can know. But, sheesh. I want to say it's time for it to come off.
Getting pretty soon.
I mean, I think maybe Sunday.
Okay, we're getting close then. Sorry, that's me.
It's okay.
I'm just signing in so I can talk to my doctor.
Well, he's asleep now.
Yeah, I don't know how long that's gonna last. He's probably
It
gonna pop right
doesn't.
back up for you in a few minutes.
It doesn't. Look,
Yeah.
I can show you the camera.
I was gonna say, any of our patients with dementia Alzheimer's, they'll, for like,
Right,
10
the little
minutes,
cat
and then-
naps.
yes,
Yeah.
and then they're up for hours.
Oh man. Right. So I'm like, yeah, he's woke more than he's sleep. And he's woke a lot.
And sometimes.
And then sometimes he'll just sleep.
Mhm.
So it's like I guess he's resting up on being up on for days or whatever. I don't know.
And the reason I'm just asking you a bunch of questions about him, I'm just trying to get a feel for his baseline. And if we're having bigger changes, or what we call it, is he going into like a transition?
Right.
Transition is more, we're gonna see he's gonna be sleeping all day long. He might wake up for a little bit, but he's gonna sleep more. He's not gonna eat as much. Confusion and agitation's gonna increase. He'll lose his ability to walk. So all these things are like, that's when we're like, okay, we're in transition, we're really deteriorating, and that's kind of, we like really prepare you. We're getting closer to, I say, the finish line. But right now, he still has some energy, he's still eating and drinking for you, his bowels are still good. Yes, he has periods of confusion, but could it be from his Alzheimer's, could be from an infection? Could be,
Right.
you know,
I forgot.
the infection
Because just a
could be
urine
driving-
infection would do that.
Yes,
Yeah.
so if it's something, yeah. So if there's any infection base, it makes confusion worse and agitation. It can make it worse. So we'll just continue like with our nursing visits to evaluate him for that and let you know.
Okay.
I'm gonna right now, I'm just messaging Dr. Leland to see about antibiotics and getting you some comfort meds. Cause I know you have some left over from the other hospice, but we want.
But you guys can't even give that.
You got it. We have to have ours to give
I know.
it in. You got
That's
it.
fine.
You got it. So as long as you have it here.
Wait, what is this? What is that?
That was on the floor, so I don't. It might have been. I don't know.
Huh.
I'm not sure if that if that was from the drink or from something else.
Yeah, I don't know what triggered today. But,
Yeah, it might have just been the way he was sitting, or just like his airway was, whatever.
well, it's been like it started last night.
Oh, really?
Yeah, it started last night. And then I was like, okay, well, if it get any worse,
Mm-hmm.
then, I'm going to take him to the ER. Because, and I monitored his baseline. So I know he's at 88% without the oxygen mask on. And then with it on, it's at 95%, but it's supposed to be higher than 95. And that's what my concern is. I got a lot of good information. I can go back and watch later. Oh, I know I'm looking crazy. It was a Sabbath day. Yes, we're just waiting to see what the doctors say.
I know it takes a minute to read everything.
It's okay. Oh, that feel good. I could scratch it.
Yeah, put your hair down and relax.
Oh, that feels good. My head was itching.
Sorry, I have to write everything to her.
Oh my word. It's so funny. I was just talking to someone online about hair scarves. When we have them so tight, we be like squeezing our brains.
Let me see if there's a date on here. Trying to see when the last time he took this.
Oh, is that the cough?
The antibiotic visit for myacin.
Oh man, he haven't had that issue in a while.
Okay, it's been a while.
Yeah,
I'll just tell him that.
yeah. Because the date should be last year.
Yeah.
I just keep it for
No, it's good for record keeping.
right because I don't know how to like. Well, okay, now I'm in my healthy vet, so I don't have to. Before I wasn't able to get into my healthy vet to see his prescriptions, so I just kept them. Because they kept saying, what was he? But then, you know, VA, they know. It was only for like non-VA. She don't want to be on camera, but she's really nice. How the way it was squeezing my brain cells.
Start there. Let's see what else I need to write. Let me give this back to you and we put it right there so we don't lose it.
Okay, now put it back in the cage.
We'll give her a minute and see if she's up.
Well, once she get that paperwork together. It's a long process. My house has became a hospital. And it has been a hospital for a while. So. Oh, and it's like his BP his baseline is really high now. Like,
well, we might have, I don't know, is he still taking his diuretics?
yeah, he's taking both of them.
Okay, so we're still on our diuretics. Was he ever on any blood pressure medications before we signed him on to service?
Mm-hmm.
Because it's not unusual for us to take him off. Like our patients on hospice, we will sometimes discontinue some of the blood pressure medications.
Why?
Sometimes it as their condition changes, and if we're not really monitoring blood pressures, we don't want their blood pressures to drop, especially if we're giving them a lot of comfort medications, narcotics, benzodiazepines. Then it can really drive that blood pressure down.
Oh, well, that sucker been high. Yeah.
I was looking at that.
Yeah. It, like, you see like 168 over 77, 147 over 90, 141, Is that 141? Yeah, 141 over. So I mean, the 140s, that one's pretty good because its baseline is like 144. But anything of that is like no, it's high. Yeah.
And do you know? And I guess next time when you check it and his blood pressure's high, just look at him. Is he just laying there, or is he grimacing and clutching his fist? These are all nonverbal cues. And I'm having pain, but I can't tell you. See what it looks like. He might be having pain, and he can't tell
He's
you.
always talking about he's in pain. I think it's time for his hip to be replaced again. I'm going to be honest. He's always complaining of pain.
And that's the other thing we might need to start addressing as well. And with hospice, we don't do any aggressive treatment or surgeries. We just give medications to help.
Yeah, but
alleviate
what
the
if like for
But if
instance,
you want to sign
if
off,
it's no, but
Yeah.
okay, so like what if for instance, he needed replaced because it's the other one's way old and it's past the 10-year mark or whatever, and if he's constantly complaining of it, then what if that's an issue?
so that's
Do we not deal with it and just be like, well, we're gonna keep having you stand up though you're in pain?
I know it's one of these hard things. It's kind of the gray area with hospice, is because we are here for comfort. We don't do anything aggressive. We don't do surgical procedures.
But palliative care can.
They
Okay,
can.
that's fine. That's cool. Long as we can deal with it, then that's cool. Then I smile. See, I smile. Other than
And
that, I'd be
here's-
stressing.
And here's the other thing. And if we're just with,
Because I'm sitting there going, he's constantly complaining about that hip. He's constantly complaining. And I know that he had surgery there or a hip replacement, but I think it was like 20 years ago. It was like forever ago.
And here's the thing. If for any reason you guys are like, hey, he's going to go in for an elective surgery, say his hip, let us know.
Okay.
Because we need to know.
Right.
From a hospice standpoint, because with certain things, he can't have hospice and certain things done at the same time.
Oh, he has concurrent care with the
Does he
VA.
have- okay.
Yes.
Okay, so
Oh yeah. Well, I did my due diligence,
okay, so
definitely.
that- okay.
Yeah,
So
he has concurrent
'cause
care.
That's always my thing. Is
Because everything is
billing and
through the
insurance.
VA.
Okay.
Yeah. So, but if he was to go like outside, only time that he goes outside is through community care. So the VA sends him out. Like the CT and all that other stuff that's getting done, his biopsy, that's outside. But
I'm gonna talk to doctor. I have to talk to doctor.
okay, and I'm gonna go upstairs. Okay, I need a moment.
Yep, take your time. I'll call for you when I'm ready with everything.
Okay. This is difficult.
If no one's forcing you, then you shouldn't have to.
Oh, that job.
You made the decision to do this to yourself, not me. I didn't tell you to do this. You did this to you. Now I have shorekeeper. I don't really know. I just have shorekeeper.
Shay,
Yeah.
I need you off the phone. Can you sit downstairs for a minute? I just need a minute. I just need a minute. I just need a minute. Oh my God, this is a lot. Oh my God. I just need a minute. Yeah. I'm just gonna go. I need a minute. I need a minute.